This technique here is the posterior rotation manipulation, high velocity, low amplitude thrust of the left sacroiliac joint. The aim of this technique is to force the ilium to rotate posteriorly. And we'll do that by a short thrust technique into this direction. The patient, in this case, will lie down on the right side. And I'm going to ask Brian to actually put his hand and arm behind him. What this will do is lock up the thorax so that we can't get over-flexion and over-rotation when we go to do the technique. I will then loop my hand and arm through his hand and arm in the manner shown. I'll get him into neutral with both legs, and then the top leg will be flexed up to its maximal point and then pressed against the area at the anterior part of my hip at about my belt line. The heel of my hand will then slip through into the anterior superior iliac spine, being careful to make sure we don't get into a spot where the patient is very uncomfortable, which is easy to do there. So I've got a nice comfortable spot that I can confirm by looking at Brian, and he says he's okay. The right hand in this case will land on the ischial tuberosity, obviously on the left side. And you can see my forearms effectively are in a straight line. And that's important because we're going to push through straight lines to produce the rotation, so the axis of movement is between my hands. I'll then take up the full range of posterior rotation, the hip flexion, and we're at end range there, and there's a nice hard pathomechanical block. You can see that my body is well set, I'm relatively upright, and I'll breathe normally. I'll get to the end range. I'll explain to Brian that I'm just going to perform a quick movement to his ilium in this side and get his permission to do so. I'll back off just a little bit, come back up to the barrier again, and I'll breathe out, and a quick thrust into the posterior rotation direction. Release the patient. We can then reassess the movement, and hopefully we've gotten a good response.